Hello, this is Array Beidler, the Privacy Officer for Pacific University. Today we're going to be going over the HIPAA policies that were implemented from about May to December 2014. This is a training review for all workforce members. Here are the instructions. So please review each slide of this presentation and then click on each link to access the policy. You can also go straight to the policies page in Moodle and review all of the policies. This is going to require a login into the Moodle page. So once you are logged into Moodle, you can scroll down and you should be able to either go into the folder for fall policies here and have a list of all of the policies that were implemented. Or you can go down and look at the full list of policies that we've implemented over the past couple of years, which is right here. And you're able to click on each of the links and review the policy. And they're in alphabetical order. If for some reason you don't have access to the Moodle page, please email me. My email is right here. You should have access from the batch of policies that were reviewed in the spring. So this time review the privacy policies and the security policies and then complete the short quiz acknowledgement and you will be done. And then we will add these policies to your annual HIPAA training. Please complete this by Friday, February 20th. And again, if you have questions, email me. So here's the batch of privacy policies that were implemented, and we'll just quickly go through them, but also please refer to the policies and read through each one. So we'll start with minimum necessary, de-identification of protected health information, some general guidelines to safeguard protected health information, and then we're going to go through 4 of the patient rights policies, the accounting of disclosures, the confidential communications, the right to request an amendment, and the right to request a restriction. Just a quick reminder of what PHI is. Again, that's protected health information, which could be transmitted or maintained in any form. So electronic, paper, verbal, in any form you can think of. And then could reasonably be used to identify the individual, and then it also relates to their past, present, or future mental or medical health. So the minimum necessary policy really talks about the need to know and access. So it also talks about disclosing protected health information. So if you're confronted with the scenario, you need to, and there's a need to disclose protected health information, you should ask yourself, what is the purpose? Do I have the authority to disclose this information? How do I safeguard the information? And then is the location or the area appropriate for sharing this information? And then the bottom line, no protected health, only protected health information necessary and appropriate to fulfill your role as an employee should ever be accessed. Each of us is responsible for only sharing and using the minimum amount of health information necessary to complete a task. We're not going to use all of the information. We're going to use what we need that is necessary. Only release the information requested. So if we receive a request for information, you're going to release only what they're asking for. And if it's not specified, you need to ask what information is necessary. For non-routine requests from either providers you don't know or out of the ordinary, you're going to make sure that you analyze and identify who the requester is. So for more information on this, click on the link here and access the policy. So de-identification of protected health information. Whenever possible, we want to use de-identified information. Again, this goes along with the minimum necessary. If this cannot be done for research reasons, we can use a limited data set, and this policy will be coming in the next year. You can refer to the policy here about what de-identification is. But we also have a slide on the 18 HIPAA identifiers. So at any one time, any of these could be considered an identifier of an individual. and especially if they're used together even with any other information. So take a look at these here. We do have a few tips we're going to list from the general guidelines to safeguard protected health information policy, but we'd like everyone to review the entire policy and make sure that you know the ins and outs of this, and also remember that this doesn't cover every scenario. So just some here. Never share your username or password with anyone. Unless maybe you're calling the help desk, but they're not going to ask for that. They're going to ask you some other questions. Keep track of transportable data, such as flash or USB drives. And if you are in a clinic, make sure that you are using an encrypted flash drive. Conversations about patients should not occur in public places like elevators or hallways. Whenever possible, we want to make sure that we're in a closed area and we're aware of our surroundings. When PHI is carried from one building to another or transmitted through interoffice mail, we need to make sure it's in a sealed, tamper-proof envelope and addressed to the party who should be receiving it. It's also a good idea to confirm receipt of that envelope. Mobile devices that are used should not download or store protected health information. All fax transmissions should contain our confidentiality statement, and you can click here and make sure that you add that to your cover sheet. All visitors must sign in and out of our clinics. And remember not to leave any protected health information on a voicemail. And then remember to report any potential breaches to the privacy officer, and here's the link here for the email and the phone number. So now we're going to quickly go through the 4 patient rights. The right to inspect and copy was in one of the first batches of policies, which included the authorization form to release information. But we're going to go over these top 4 here. So an accounting of disclosures is a report of all the disclosures that have occurred on a patient's record. Patients have a right to request and receive this for the past 6 years of healthcare. And we at Pacific University have 60 days to provide that report to the patient. Remember that not all disclosures will be included in an accounting of disclosures. Typically that includes treatment, payment, and operations, which is the bulk of disclosures. Disclosures made with an authorization or to the patient. And there's also a lot more listed there that you can find in the policy. The report that comes out for the counting of disclosures should include the date of disclosure, the name of the person or entity it's disclosed to, a brief description of the PHI disclosed, and the purpose. So please refer to the policy and also make sure that you use the form. If a patient is requesting an accounting of disclosures, they need to complete the form and send that to the privacy officer. So confidential communications. Patients have a right to request communication by alternative means or locations. If this is approved, it applies to all future correspondence. This needs to come through on a form. Again, there's a request for confidential communications. And then each clinic has its own process for documenting how this is going to occur within the patient's record. Patients also have the right to revoke their request. And again, that needs to come in writing. So please make sure you look at the policy here. Request to amend the protected health information. Patients have a right to request an amendment to their record if they feel it is incomplete or incorrect. An amendment means adding or appending information. Remember that once a record is signed, there will be no removing or deleting of information in that record. Requests must be in writing. We do have a form for this as well. And records must have been created by Pacific University. We cannot change any other entity's records. And again, we have 60 days to respond denying or approving this request. There is a lot of logistics with this, so you can read through the policy, but pretty much, if approved, the amended information is included with all future disclosures. If it's denied, we need to let the patient know. They may also submit a statement of disagreement We can also send a rebuttal back, and then the patient can also request that the disagreement statement be included in future disclosures. So there can be a lot of process with this one. Again, there's a form that needs to be forwarded to the privacy officer, and also review this policy for more information. And finally, the request for restrictions. So patients have a right to request restrictions of the use or disclosure of their information. These must be processed by the privacy officer. There's one required restriction that we have to agree to. That is if they pay in full for their service at the time of service and they don't want the information to go to their health plan. All other requests may be denied or approved, and they should be, again, on that policy or through the forms through the privacy office. Okay, let's take a breath. We're halfway there. We're going to move on to the security policies. So we have a lot of security policies as well. We're going to go through these. Some of these are more just for your information, and they are things that the university and our UIS department are going to be doing, and nothing that you need to do, but just to be aware of. So biomedical devices, UIS inventories biomedical devices by department, school, and college. Only these devices that are inventoried will connect to our networks. Departments and individuals need to notify UIS when new devices are used or removed. And there are malware protections for devices being used and encryption if that is available. So for more information, please refer to that policy and make sure that you review it, especially if you're using biomedical devices. Data integrity. Systems that access electronic protected health information will be evaluated to ensure data processing integrity. This is making sure that we are using industry accepted standards such as encryption, user passwords, and secure facilities. UIS will back up our PHI, perform periodic vulnerability assessments, and other types of performance. So please make sure that you review that policy as well. Facilities access and maintenance control. This is pretty simple. Gets down to limiting access to our server rooms, which will require an authorized badge or key, and also has an activity log for access to our server rooms. Again, you can read through the policy here. Information System Activity Review and Audit. Pretty much this is just explaining how every system, especially our electronic health records, creates an activity log of user access, which can be down to the second. Audit logs and access reports are routinely reviewed by authorized users, and they're looking for unauthorized access. If there is unauthorized access, this can lead to disciplinary action. And this is really just to protect our systems to make sure that users are using records appropriately. And again, you can review the policy here. Mobile devices. Mobile device users connecting to the network must agree to these things. They need to enable encryption of data on their mobile device, create a PIN or a passphrase, auto lock the screen after 5 minutes, not allow unauthorized persons to access or view if you're looking at protected health information on your device, and then only view PHI through our university approved portals. Do not download any PHI, and report any lost or stolen devices to UIS and the police immediately. Again, there's more. If you would like to review the policy, please make sure that you do. Remote access. If you are accessing our university resources remotely, you need to make sure that you are following the guidelines based in this policy. Any third parties will follow procedures as well and have appropriate contracts in place. And again, make sure that you are not downloading protected health information on personally owned computers. Please make sure to review this policy. Risk analysis and management. The university will conduct periodic assessments of risks and vulnerabilities to make sure that our information is kept confidential and the integrity of our protected health information. Please review this policy as well. Security evaluations. Uh, This policy explains how we will conduct periodic technical and non-technical evaluations to ensure that our security safeguards are working, to ensure that they're also being maintained. There will be periodic re-evaluations that may be triggered by a known security incident or breach, new threats or risks, new security technologies, or changes to our policies, to regulations at either the state or federal level, or security requirements. You can review the policy for more information on security evaluation. Okay, the policy review is complete, at least the slides here. So please make sure you read through all of those policies, that you understand what your responsibility is, or the general information about those policies. Please access and complete the one question acknowledgement in Moodle. If you click on the link there, you should be able to get to it, or you can go straight to the Moodle page and find the Fall 2014 HIPAA Policies Acknowledgement. This completes your policy review. If you have questions, please contact me or Jim Fleming, or if you have any incident or security-related issue, please contact the help desk. Thank you again for your time.